This is Average Joe PT, and on last episode we talked about, I'll leave a link up there, all about sprains and strains and how you tell a difference between one and the other. So hopefully after this video you go back and you kind of look at that one. That's a nice little synopsis of what the heck is the difference between the two. And then there are some treatment links in there of if you sprain your ankle or twist your knee or something along those lines. So on this episode we're going to talk about pain related to cartilage. Now, people describe I just have joint pain. Now, whether it's coming from the knee or from the spine or one of my little collections of models over there, shoulder, ankle, or foot. Your treatment plan is really going to be probably about the same because the issue is still the same origin, which is cartilage damage. So on this episode, we're going to talk specifically about the different types of cartilage and what you should look out for and different ways that you can treat and what your expectations are. If you do damage your cartilage in whatever these joints, you have some sort of idea what your plan of attack is going to be. So let's go ahead and get started. So I'm going to take you back a little bit. When we talk about cartilage, there's really three kinds. That's right, our body has three different kinds of cartilage. It's not all one and the same. The ones that we think of in the knee are meniscus, okay? Those little shapes right there, that's a type of cartilage. And then we have over the bones themselves, that's a different kind of cartilage. And then of course our nose or our ears, that's a different kind of cartilage. So we have the hyaline cartilage, we have that elastic type of cartilage. And so those various types of cartilage have different types of, literally if you look underneath the microscope, they look a little bit different, okay? As well as the properties of that particular cartilage. That's why they look a little bit different underneath the microscope. And you're gonna have different expectations of your treatment as well as your healing if you damage one of these particular types of cartilage. So first thing you wanna do is, if it's a trauma-based, you fell and you hurt yourself, banged your knee, twisted your spine, and the doctor says, yeah, I think you tore your meniscus, or I think you maybe inflamed the cartilage in whatever joint we're talking about, whether we're talking about the spine, kind of a close up there, or if we're talking about maybe the ankle, foot. And in those different aspects of the joint, really depends on what type of treatment you're going to be looking at. One, if we're looking at the knee specifically, let's say you twisted the knee, 6 weeks out, the doctor does an MRI and he says, you know what, you have a tear in the meniscus. Now, if it's, I've talked about this in previous episodes, I'll leave a link up there to my knee catalog. I go over the various types of injuries that you can have in the knee and some treatments for it you can do at home, as well as some expectations. But on this episode, when we're looking at the different types of cartilage, now degenerative knee, like you get a little bit older and that wearing of that cartilage on the surfaces of the knee, the hyaline cartilage, that unfortunately becomes pitting, and next thing you know, you're dealing with some osteoarthritis because the cartilage on the knee has worn down, whether it is you were just way overactive or unfortunately maybe way over obese, and that wears down the cartilage quicker, thins in certain spots, and you're dealing with that. Or if you're dealing with, in this kind of situation where the disc has gotten torn or worn down over time, and now we're dealing with some facet issues on the back side of this joint where my fingers are at, a nice little close-up of it. And in those particular joints, the cartilage wears down because it's taking so much stress because the disc isn't there or isn't doing what it used to. And in those particular scenarios, you're really dealing with the same problem, the osteoarthritis, whether it's in the knee joint or in the spine or in any other ankles. You're dealing with inflammation. That big word, inflammation, is your big issue. And so what you want to do, it's what I always say, first thing you want to do is try and reduce it either through medication, through icing, and you want to take some sort of activity like non-compressive, maybe walking, swimming, any of those types of activities that is going to get that synovial fluid, whether it's in the knee joint, whether it's in the spine or some other joint. You want to get that synovial fluid within that joint space because that's really what's going to nourish and help reduce the overall inflammation over time. So you gotta take an active approach when it comes to this. Now, if you're dealing with, like I said previously, a meniscal tear, now we're talking about, all right, is it the outer third, 1/3 that might have some healing properties to it, because there's some vascular blood flows going to it, or are we dealing with that 2/3 where it's really just synovial fluid in that part and it's not going to heal? So that's a whole other episode onto itself. I'm going to leave a DM down below if you want to ask a question about that. If you like this episode, hopefully you will give me a thumbs up so we can go ahead and send this out to other people, because we can't help anybody else out if we don't leave a thumbs up for those people. All right, back to the show. So if we're dealing with something like hyaline cartilage, or this, not hyaline, elastic type cartilage, where you can pierce your ear and it doesn't really hurt, because really there's not a whole heck of a lot of blood flow there, and there's not a lot of nerve endings there to begin with. Yeah, it might hurt initially, but after that it's not going to continue. Then you're golden. You can, you ever see those wrestlers out there that have that giant, cauliflower ear because it's just totally damaged and it just doesn't heal itself. There's not enough vascular blood flow in that area, and you're dealing with a damaged ear the rest of your life, unless you have some sort of surgical procedure, plastic surgery, where they can correct that. Now, when you're talking about those types of cartilage, it really does make a significant difference when we look at treating those types. So we talked about, if you have an osteoarthritis piece, you want to get that inflammatory process to calm down through icing, through anti-inflammatories, through non-compressive forces, and maybe, like I talked about, walking, swimming, bicycling. Now, the other huge thing is we haven't really talked about yet is what happens if over time it doesn't seem to improve at all. The doctors diagnose you with osteoarthritis, and it just continues to damage and damage and damage, and it's pain and pain constantly. The best approach that a physical therapist will ever give you, we're only dealing with just chronic joint pain, it doesn't seem to want to calm down, you've already tried all the meds, is water therapy. Because the issue when we're talking about the knee and the water is you're literally dealing with a buoyancy level of, if you're up to your waist in the water, you're really only dealing with about half your body weight on that joint. If you're up to the chest, you're really dealing with probably 70 to 80% less of your body weight. So you're really dealing with moving compressive forces about 20 to 30%. When you're at your neck level, your joint is really only taking about 10% of the compressive total force. So if you weigh 200 pounds, that knee joint is only taking 20 pounds of pressure. That's why your pain's a lot less, and why it's so much easier to move around in the water than it is on land with gravity. So you want to try and do that because it's going to improve the range of motion of the knee. And one huge thing is it will help pump that fluid out of that joint if you're having a lot of swelling in the knee joint or the spine, any of these other joints, because you want to definitely keep that fluid, that swelling fluid out of there as much as possible. Keep that joint moving to get that synovial fluid in there. Keep that range of motion going. Keep that possibility of strength going versus becoming static and becoming weaker. Muscles, when they become weaker because you're not using them, means that you're going to take a lot more force on that joint, whether it's the knee, whether it's the spine or the hip. I talked about in the spine way back, I'm going to leave a link up there. The culprit was the multifidus muscle, which that actually shrinks when we're dealing with degenerative issues with the spine, we're dealing with chronic back issues. That muscle actually gets fat tissue in there and shrinks because you become so inactive because you're in so much pain. And so it's very, very significant that you keep moving, and in this case in the water, because that's the least amount of force you can put on any joint when you're dealing with cartilage issues that are worn down, and you're dealing with inflammatory issues and also having a lot of pain. And to overcome that is by that particular activity. So if you're going to any type of discipline, whether it's the chiropractor, whether it's the medical doctor, or the physical therapist, you definitely want to put water therapy in there if none of the other types of treatments have been effective, whether that's surgical, medicine-based, pain management-based, or just you went to land-based physical therapy and it didn't really help. So if you guys have any questions about that, like I said, leave them down below. I try and look at those at least several times a week. Don't forget about my walks that I do several times a week, as well as I'm gonna leave a link up there to my video I did yesterday about some further education, going over research-based brochures and pamphlets and booklets, and you name it, whether we're looking on the internet and it comes to any type of research-based is what I'm going into. So I want you to take a look out for that also. And so until next time, Scully and I always like to say, look up and keep smiling. See you next time, folks.